This is how you should answer MMI med school interviews. Hi, I'm Serena. I'm a med student at Harvard. I was pre-med at Hopkins. And these are the 3 things that you should target when you answer an MMI ethical scenario. First, you're going to understand and evaluate the situation. This includes asking the interviewer clarifying questions so that you're certain that you have the scenario correct in your head. It's also very briefly repeating back to the interviewer what you understand of the situation so that if there's any discrepancy, they can correct you. Step 2 is to ask questions. You want to ask questions from the point of view of all of the stakeholders or people involved in the scenario. For example, if the ethical situation is that there's a patient who's refusing treatment, but the family members really want the patient to receive treatment, there are 3 people in this situation: the patient, the family, and the provider. You would ask questions to each of these stakeholders to understand where they're coming from and why they feel that way. Step 3 is taking actions based off of your values. So in that previous situation, let's say you ask the patient if they understand all of the information, if there's any reason why they're refusing treatment. If the patient says that they understand everything completely, they know all of the consequences, then you are going to uphold patient autonomy. However, if the patient talks about how they have difficulty accessing medication, then you would be upholding the value of equity. You should walk the interviewer through all of these different situations based off of how the stakeholders would respond to your multiple questions.